Hello, I'm Dr. Andrew Neville. I specialize in the treatment of adrenal fatigue and related chronic illnesses. And the chronic illness I want to talk about today is anxiety. I want to give you my take on anxiety. It might just kind of open you up to thinking about it in a little bit of a different way. Anxiety and depression are incredibly common with people who have adrenal fatigue. Incredibly common. The connotation in conventional medicine and what we've learned about, even just in society, is that these symptoms are purely psychological problems. Well, you have anxiety disorder or you have depression, right? Whatever part of that you want to call it, there's all kinds of names to call anxiety. What I'm here to tell you, though, is that anxiety is not purely a psychological problem. There is underlying neurology and biochemistry that create the symptoms that we feel of as anxiety. So when you think of anxiety, think of the symptoms, right? What are the symptoms? Whether it's sweating and racing thoughts and palpitations and, I got to get out of here, doing all that stuff, right? Which is primarily a bunch of adrenaline in your body, right? When a tiger jumps out at you, and you dump a bunch of hormone, you're in fight or flight, you dump cortisol and adrenaline and all that stuff, right? Because you're ready to fight the tiger. What if there's no tiger to fight? Where does that adrenaline go? You can't burn off all that adrenaline. You just got to kind of wait for it to leave. So this is our stress response system. I've talked about it in other videos, basically the balance between fight or flight and rest and digest. What happens with chronic stress over time is the CEO of your stress response, which is your limbic system, deep in the brain. The limbic system gets sensitized. It gets trigger happy and starts over-interpreting its environment as being stressful. So a minor stressor doesn't generate a minor response anymore. It cranks up the amplitude. A minor stressor now generates this major response where our body would have made a little bit of an adjustment just to handle whatever that perturbation was. Now our body's making mountains out of molehills. Now we're running from a full-on tiger just because our blood sugar might have dropped, which is a trigger to the adrenals. And the adrenals just kind of explode with hormone. And all of a sudden you have anxiety. Now keep bathing the body in all those hormones and certain patterns start to develop, neurological networks, neural circuits kind of firing together all the time. And we will get kind of perpetually stuck to the point where it's not just like panic attacks things sometimes, it's more low-level anxiety perpetually. What I'm here to share with you is that if you fix this physiology, that anxiety can go away. It absolutely can. And you don't need kind of targeted all the anti-anxiety medications and things like that to do it. What conventional medicine does is they recognize the symptoms of adrenal fatigue or a chronically activated stress response system. So they see the symptoms and they treat those as things, whether it's fatigue, pain, insomnia, brain fog, anxiety, depression, blood sugar problems, blood pressure problems. You can cover up the anxiety. Right here, take this antidepressant, which also helps with anxiety. Take this benzodiazepine, which will help with the anxiety. You're covering it up. You're not seeing the symptom. But have you fixed this? No. And what that means is you're basically putting a piece of tape over the check engine light in your car. Right? You have not fixed the underlying problem. So this shift continues and the condition perpetuates. And eventually that drug won't work anymore anyways. You got to switch. I'm not against the use of pharmaceuticals for these medications, for these symptoms. Most of my patients will come into me already medicated in this way. That's how conventional medicine pays attention. Let's put, these Band-Aids over the symptoms, which is fine. But what I work to do is fix the underlying problem, fix this overactive stress response system, and then you can have somebody shift back into physiologic balance, turning off the wear and tear, dumping all of that stress hormone, turn on the healing and repair, start rewiring the limbic system so it doesn't go down that same well-worn pathway all the time, of worry and fear and panic and all that. Fix that, which you absolutely can do. Fix that, the body shifts, these symptoms start to disappear. It happens. I know it's a different way to think about it. If you have any other questions, I've got some other videos. Click on the comment link or the link in the comments below. Check out some other videos, and maybe there's some answers there. I hope this helps. All my best.